Question 27, which of the following is the most likely diagnosis? And we just see right away, we're dealing with a bunch of ortho here. So this is our ortho MSK question. A 22-year-old man presents after twisting his knee during a basketball game. He says he heard a pop and was unable to continue playing. So pop is really important. Within 15 minutes, the knee became swollen and stiff. That is also really important. Also the timing in particular for these types of questions. On exam, there's a moderate effusion and decreased range of motion. The patient's unable to ambulate without assistance. Okay, so we don't need the last two sentences here. This is super easy. You'll get these questions right immediately as long as you know this. A pop is almost pathognomonic for ACL. Effusion timing, though, the effusion timing is also really important. They don't often tell you that there is a pop. It's usually too obvious if they do. And you can answer this question without this sentence at all. With our mechanism of injury, so we have twisting injury, not super specific, but it does clue you into either ACL or meniscal. MCL would have to be a valgus force applied, so lateral to medial force. Quadriceps tendon rupture, that could be pop technically, and he wouldn't be able to walk without assistance for sure, but usually you would see kind of like a Popeye deformity, but for the thigh. That would also present with a tremendous amount of ecchymosis just from the hemorrhage that occurred with the torn muscle. So we can cross that one off. Patellar dislocation is pretty obvious when it happens. The patella is just not where it should be. Hopefully they would describe that as feeling a hard mass of the lateral aspect of the knee. Also, though, would not be able to ambulate without assistance. So that's probably, this is a good red herring here. But honestly, if you've ever been in an ortho clinic, that's a lot of people. It's just pain, right? And it's difficult to distinguish pain from mechanical reasons of being unable to ambulate. So back to our timing. If you have effusion that happens almost immediately, it's an ACL tear every time. If the effusion takes longer to occur, say hours, if not even a day or two, then think meniscal. That's super important, and that will get you through a lot of these questions very quickly in the future. I would consider putting that one in Anki. So the correct answer here is D, ACL tear.